Coronavirus has been circulating in Clark County for over 2 years. Thanks in part to widely available vaccines and growing supplies of COVID therapeutics, the cases of death and hospitalization have declined from their peaks earlier this year. Recently, we sat down with Clark County Health Officer and Public Health Director, Dr. Alan Melnick, to learn how COVID is still impacting our region and ways public health's response to the outbreak is evolving.
Thank you, Dr. Melnick, for joining us. We are recording this interview in early April 2022, and at the moment, overall cases have fallen from their peak earlier this year. What do you believe has contributed to this decline in cases?
Yeah, so thank you, and thank you for the opportunity to meet with you here. So, during that Omicron surge, the case levels were 5 times higher. When we reached our peak in the Omicron surge, they were 5 times higher than they were during the Delta wave. And the numbers have been coming down significantly compared to 2 months ago. And we could talk about that a little bit more, but probably the numbers have come down for a couple of reasons. One is 2/3 of the eligible population have been fully vaccinated. So that would be, the eligible population is those who are 5 and older. So of course, I'm still concerned because there's, 1/3 of the population that's not eligible, that's not fully vaccinated. And the other reason is during the Omicron surge, and the previous Delta surge, we had so many people infected that infection produces some immunity as well. Infection-induced immunity. So between the people who are infected and the people who have been vaccinated, we have higher levels of community immunity. So that's contributing to the lower numbers. But I would point out that if you look at the curve, even though we're much lower now, we're meeting the CDC measures of community levels being low. Just like in previous surges, the curve has kind of plateaued out, and we're still, we still have transmission in the community. And the concern that I'm sure we'll talk about is, could we see another potential surge? So, but those are the reasons, mainly, higher levels of community immunity based on vaccination and previous and recent infection.
So now in the news, I'm seeing there's additional Omicron variants. What do we know about these? How contagious are they? Are they less severe?
Yes, and by the way, some of the things we've done to protect ourselves, including masks, help reduce the numbers as well. I'm sorry to add that. So in terms of the we're seeing now, it's becoming predominant is a sublineage. It's still Omicron, but you've heard the term BA2. So the first Omicron we saw was a BA1, and now we have a sublineage called BA2, and that's virtually all the cases of COVID-19 in the United States and in the state of Washington are Omicron. But we're now seeing the BA2 variant take over. So it's increased significantly over the last several weeks to the point where it's responsible for over 70% of the cases nationally and in Clark County, a large number of cases, and that's increased significantly. The thing that we do know about it is that it appears to be more contagious than the previous versions of Omicron, which are highly contagious. They were more contagious than Delta. But the other thing we know about it, like other Omicron, the other original Omicron lineage that we saw here, it causes less severe disease than previous versions of the virus. And the other thing we know is that the vaccines are still highly effective against the Omicron variants, including BA2. So that kind of sums it up. But that's what we're seeing more. We're seeing it. And it is more transmissible than previous versions.
So this question comes up, just are COVID vaccines safe? Are they easy to get? And remind us again what current ages are eligible for vaccines.
Thank you on that. So the vaccines are incredibly safe, and they're highly effective. And they're not only effective in terms of preventing severe disease like hospitalizations and death, they're also effective in preventing transmission as well. So when we've been looking throughout the pandemic, as we've been looking at it this locally, statewide, nationally, people who are unvaccinated are more likely to become infected than people who are fully vaccinated, more likely to be hospitalized, and more likely to die. So, and that's been true through the Omicron surge as well. Anybody who's 5 years of age and older is eligible to be vaccinated.
And if you've already gotten COVID, should you, but not vaccinated, should you still proceed to get vaccinated?
Definitely, yes. So, you know, we're seeing reinfections. You know, we see breakthrough infections. People have been vaccinated as well, and we're going to talk about boosters here. But there was a study done, a great study done in Kentucky that looked at, and I'm just going to use that as an example. People had COVID-19, I believe, in 2020, and then they were followed. Some of them got vaccinated and some of them didn't. And the folks who did not get vaccinated were close to 2.5 times more likely to become reinfected. So whether or not you've had COVID-19, you should get the vaccine, and you should get the boosters when you become eligible.
Okay, and then let's talk about the boosters. If you haven't received that third booster yet, why is it important?
Well, actually, there's a recommendation for people who are over 50 and for some immunocompromised folks to receive a second booster, and we can talk about that as well. So, you know, over time, the immunity or the level of immunity from the vaccines decreases, and that's why the first booster was recommended. You might recall that. And now, you know, looking at the data, now that recommendation has been made for a second booster if it's been 4 months since your first booster. I would point out, I want to make a couple of points about that. One is immunity wanes from previous infection as well, and the vaccines provide more robust immunity than previous infection. And having boosters and having multiple doses of vaccines are not unusual. Take a look at the childhood vaccination schedule. We give multiple doses of vaccines for a variety of communicable diseases. I mean, and I'll, you know, just list off a few: polio, diphtheria, tetanus, pertussis or whooping cough, hepatitis A, hepatitis B. I could go on and on. You know, in terms of vaccinology and immunology, sometimes, you know, it's frequent that more than one dose, you know, one shot is necessary. And when you get these additional vaccinations, including these boosters, it produces a much more robust response that can be longer lasting. So this is not unusual, but, you know, the best way to protect yourself from COVID-19 is to get vaccinated.
So if you haven't been boosted yet, get boosted. If you've been boosted and you're over 50, you're recommending to get that fourth booster.
Yeah, so the fourth, well, it's not the fourth booster, it's the second booster.
Oh, I'm sorry.
So I just want to make that clear. So, and it gets a little bit nuanced here, Jim, and I apologize. So people who are with normal functioning immune systems, their initial series was 2 doses of the Pfizer or Moderna vaccine and 1 dose of the J&J. Then they became eligible for a booster dose, you know, the first booster, which would have been the third shot. And for those people, if they're over 50 and it's been more than 4 months since their first booster, they're eligible for a booster. Immunocompromised people who got that first initial 3 series shots, you know, for immunocompromised people, then they became eligible for their first booster. If it's been more than 4 months since their first booster, they're also eligible to receive a second booster.
Okay, let's switch to masks. We've been talking about mask mandates going away in public settings. Should people still wear masks in public settings does it still provide some protection?
Yeah, so let me just cut to the chase on this one. First of all, because I want to make sure that there's a lot of misinformation going on around masks. There's great scientific evidence that masks are effective in preventing infection, and the quality of the mask very is makes a difference as well. So, for example, cloth masks, they're effective, but they're a bit more than 50% effective in preventing transmission. Goes higher with surgical masks that are up to in the 60s, and respirator type masks, KN95s and N95s, are over 80% effective. We're moving to the point where the mask mandates are gone, but people can make decisions to protect themselves, and that includes wearing masks. So, for example, if you're immunocompromised and you're going into a public setting, you may choose to wear a mask. Those of us who are not immunocompromised also, it gives you a higher degree of protection. Masks are not 100% effective. So people can choose to continue to wear masks. They may want to monitor the community levels of transmission. If we get another surge, for example, and we don't have a mask mandate in place, might be a very good idea to go ahead and wear a mask. And I would also point out that masks are not only effective in preventing COVID-19 transmission, we've seen very low rates of flu in the past couple of years as well. And physical distancing and masking works for other respiratory illnesses, illnesses transmitted through the respiratory, the airborne route, that people may choose to wear masks. And certainly people who are in isolation, if you've been a case and you're supposed to be in isolation for 10 days, you're supposed to be isolated for 10 days. If you don't have symptoms, the way recommendations work, after 5 days, you should continue to wear a mask for the full 10 days, especially, including around your family. And people who are in quarantine, people who have been exposed, should wear a mask for the full 10 days as well.
So let's switch to that. So if let's say you come down with COVID, let's talk about tests. Are COVID tests widely available, and where can people get them?
Yeah, so tests are widely available. They're available at medical clinics, some local pharmacies. You can also you can purchase at-home tests from local pharmacies, and some insurance providers have identified pharmacies where people can get at-home tests for free. You can also order at-home tests through two programs. One is through the State Department of Health, and the other is through the federal government. And both of those sources, both the state as well as the federal government, will deliver the test directly to your home. And the state program offers 2 tests per household per month, and each kit has 4 to 5 tests. So you can get 2 test kits per month from the state. The federal program provides each household with 2 tests, 4 to 5 tests each. So, and we have links on our website and the Clark County Public Health website where people can order those tests, and again, delivered directly to your home.
Great. Now, let's switch to talk about COVID therapeutics. What are COVID therapeutics? Are they available in our region? And if you do test positive, how do you go about getting a prescription for these?
Yeah, thank you. So several therapeutics are now available, and I'll talk about what they want. And they're basically, their indication is to be used in people who are at risk of severe illness, people who have underlying conditions, immunocompromised folks. And there are 2 kinds of therapeutics. One is the antivirals, antiviral medications that need to be given within 5 days of symptom onset. And this has to be done before you're sick enough to be in the hospital. The other therapeutic is monoclonal antibodies, which are made in the laboratory. They're antibodies that are made, in lab, and they have to be given within 10 days of onset, and again before you're sick enough to be in the hospital. These are both they're available at local pharmacies and medical clinics, but they have to be given by prescription. So you can't just go in and get them. They have to be given by prescription. And if you think you've got COVID-19, And certainly if you test positive, that's something you need to talk to your healthcare provider about quickly. Again, they need to be administered soon. There's also a therapeutic. I don't know if therapeutic is the right word for it. It's a monoclonal antibody. It involves 2 monoclonal antibodies called Evusheld. That is a pre-exposure medication. So use up not only before you get COVID-19, but you can use it before you get exposed to it. And that's for people with moderate to severe immunocompromise. And people who are immunocompromised really need to talk to their healthcare providers about getting that as well.
Well, I have more questions, but we're out of time. COVID has led to a wealth of misinformation. So where should people turn to get credible information?
Yeah. So, and by the way, just quickly, the antiviral medications are oral. They're not injectable like the monoclonal antibodies are. Yes, there's a wealth of misinformation out there. So, if people, first of all, talk to your doctor or your healthcare, your healthcare provider. There are reliable sources online. The Centers for Disease Control, CDC, cdc.gov. There's Washington State Department of Health, doh.wa.gov, and there's Clark County Public Health. And the Clark County website is clark.wa.gov/public-health. And actually, if you just go to clark.wa.gov and look for departments, you can find us as well. The Washington State Department of Health also operates a COVID-19 hotline that's available 7 days a week. And they can answer questions and direct people to resources, including vaccine locations and testing locations. And that, I'll give you the phone number. It's 1-800-525-0127.
Well, Dr. Melnick, thank you so much for taking your time out of your busy schedule to talk about this, and hopefully we'll get through this together.
Yeah, we're monitoring things really closely. We know that there's a surge going on in the UK, for example, and we're monitoring things closely. And I just make a last plea to folks to get vaccinated. If you're eligible for the booster, and including the second booster, get boosted. Yes, thank you, Jim.